Welcome to this explainer. Today we're looking at a medical intervention so fundamental and so deeply ingrained in emergency and restorative care that it's practically synonymous with life support itself. We're talking about the essentials of oxygen therapy. It's a vital, life-saving therapy that simply increases the supply of oxygen to a patient's lungs. But how exactly does it work? When is it used, and what are the mechanics behind delivering this invisible medicine? Okay, let's dive into this and decode the science and the equipment that make it all possible.
Here's our roadmap for today. We'll quickly hit on why we need oxygen, 2, diagnosing low oxygen levels, 3, oxygen sources and equipment, 4, the anatomy of an oxygen tank, and 5, methods of oxygen delivery.
All right, kicking things off with Section 1, why we actually need oxygen.
Okay, we all know we need oxygen to survive, right? But think about this from a strict clinical perspective. Oxygen is essential for life, and the body has no reserve of it. It's a pretty crazy concept when you really think about it. Your body can stash away fat for energy, it can store water, it can even store certain vitamins for months. But oxygen? Nope. If you treat the human body like an engine, this is the one fuel we literally cannot store. We have zero reserve. That means the absolute second your intake drops, your body is in immediate high-stakes peril.
So what happens when that fuel drops? How do you know you actually need oxygen therapy? Well, your body starts throwing up some major red flags. Shortness of breath is the obvious one, sure, but look at these other symptoms. Irritability, morning headaches, ankle swelling. It's kind of wild how being starved of an invisible gas shows up in such physical, everyday ways. Your brain is practically crying out for it, which gives you those morning headaches and mood swings, while your cardiovascular system is struggling so much that fluid actually starts pooling in your ankles.
Now, in a clinical setting, doctors are looking for specific medical crises that scream for immediate oxygen therapy, and it's remarkable how an oxygen deficit hits basically every major system of the body. You've got respiratory compromise, we're talking cyanosis where the skin literally turns blue, tachypnea or rapid breathing, and partially obstructed airways. Then you have cardiac compromise, meaning chest pain, shock, tachycardia, and arrhythmias. And let's not forget neurological deficits. Strokes, spinal injuries, or a coma severely disrupt oxygen pathways, making therapy an absolute must.
Moving right along to Section 2, diagnosing low oxygen levels.
So how do doctors actually measure this deficit? There are two main ways. First up is oximetry, which you've probably seen a million times. It's just that small, totally non-invasive little clip they slide right onto your finger, a toe, your earlobe, or even an infant's foot. It's fast, painless, and easy. Then, on the flip side, you have the arterial blood gas test, which is a bit more intense. They actually draw blood directly from an artery in your wrist. But the trade-off is that it gives doctors an incredibly precise reading of both your oxygen and carbon dioxide levels.
And what exactly are they looking for with those tests? Well, the magic number to keep in mind is 90%. When doctors run these tests, whether it's the simple clip or the blood draw, they're looking at your oxygen saturation as a percentage. And if it drops below 90%, that is the critical threshold. Once you dip under that line, oxygen therapy goes from being a maybe to a medical necessity.
Okay, Section 3, oxygen sources and equipment.
When it comes to getting that oxygen to the patient, hospitals have a few different options. Obviously, you have those massive, heavy, liquid portable systems. You know, the classic tall metal cylinders you always see grouped in hospital hallways. But contrast that giant scale with modern oxygen concentrator wallets. These little guys are electrically powered, incredibly compact, and designed so you can just sling them right over your shoulder. It really is a game changer for giving patients some actual mobility at home.
Beyond tanks and wallets, there is also crucial manual equipment, like the manual breathing bag. You'll see these heavily used during CPR to literally force air into a patient's lungs in an emergency. And for the really severe situations, think major surgeries, trauma, drug overdoses, spinal injuries, or advanced chronic lung diseases, doctors will bring in a mechanical ventilator to completely take over the work of breathing for the patient.
That brings us to Section 4, the anatomy of an oxygen tank.
Now, if you've ever stared at the top of an oxygen tank, all those metal valves and fittings can look super intimidating, right? But it's actually a beautifully logical sequence. It's perfectly designed to take this highly pressurized gas and step it down into a gentle, breathable stream. Let's break down exactly how these pieces work together so it feels a little less foreign.
All right, piece by piece. First up is the pressure gauge, which is usually the dial closest to the actual tank. It simply tells you how much oxygen is left inside. Pretty straightforward. Next is the regulator. This thing is absolutely crucial because it safely releases the oxygen at a controlled, desirable rate. Without it, the pressure would be dangerously high. Third, we have the flow rate meter, showing the medical pro exactly how many liters per minute are flowing out to the patient. And finally, and this is a really clever detail, step 4 is the humidity container. It uses pure water to add moisture to the otherwise bone-dry oxygen. If they didn't do this, the patient's mucous membranes would completely dry out.
And finally, Section 5, Methods of Oxygen Delivery.
So how does that regulated oxygen actually get into the patient's lungs? Well, the most common delivery system by far is the nasal cannula, or nasal inhaler. It's an elegantly simple device, just 2 small tubes that tuck comfortably right into the nostrils. The beauty of this device is that it doesn't get in the way of eating or talking, which makes it incredibly tolerable for long-term use. It's especially great for elderly patients, or folks recovering from things like strokes where vasoconstriction is a real issue.
But the cannula definitely has its limits. It is strictly built for low flow rates. Medical professionals will carefully dial the flow rate meter to a very specific window of just 2 to 6 liters per minute. It's really just there to give the patient a small to moderate bump in oxygen. And at that specific flow rate of 2 to 6 liters per minute, the cannula delivers a precise oxygen concentration ranging from 28 to 44%. For a stable patient who just needs that targeted moderate boost, that concentration is completely sufficient.
So why the hard cap at 6 liters? I mean, why not just crank the dial up if they need more, right? Well, pushing it past 6 liters per minute doesn't actually help, and it causes some major discomfort. It dries out the nasal passages so badly that it can easily lead to what doctors call epistaxis, or in plain English, a really bad nosebleed. Also, doctors won't use a cannula at all if the patient has irregular breathing, because the delivery just gets way too inconsistent.
If a patient requires higher concentrations of oxygen than a cannula can safely handle, it's time to upgrade to a face mask. A simple mask bumps that oxygen concentration up to the 40 to 60% range, allowing for a higher flow of 6 to 10 liters per minute. But if they need even more than that, doctors bring in the partial rebreathing mask. This one features an attached bag and an absence of valves, which lets it deliver a massive 60 to 90% oxygen concentration.
Okay, let's step back for a second to wrap up this explainer. We've spent this whole time talking about oxygen as this miraculous, life-saving fuel. But can too much of a good thing actually be harmful? It's so tempting to just think of oxygen as extra fresh air, but it's not. Oxygen therapy is the administration of a prescribed therapeutic modality. Literally, it is a drug.
And just like any medical intervention, it carries real, distinct risks. If you overdo it with humidified oxygen, you can trigger bronchoconstriction, which is an actual tightening of the airways. Furthermore, if the air is overhumidified, it can ironically lead to decreased lung function. And let's not forget, anytime you introduce moisture via that humidity container, you inherently increase the risk of infection. It really leaves us with a profound realization. Oxygen is the absolute non-negotiable fuel for human survival, but it is also a highly volatile drug. If something as natural as the air we breathe requires this much precision to heal instead of harm, what other invisible medicines are hiding in plain sight? Thanks for joining me for this explainer. See you next time.